Here in the Philippines, people are very wary about the kind of vaccine that will be injected into them, particularly the Chinese vaccines. How do you address that fear?
So, our survey showed that significant numbers of Filipinos, as represented in our survey, are deeply concerned about Chinese vaccines. And yet, we all know that we need those Chinese vaccines because there's not enough Western vaccines to go around. So this is why, we also included in our survey a question about politicians being vaccinated. And 71% of our respondents, 15,000 respondents, basically said, look, I would like to be vaccinated after our politicians have been vaccinated.
Yeah, but
so in our press release, we actually recommend that the president and all our politicians, mayors included, be vaccinated at the early part of the vaccine campaign. Not with CoVAX, not necessarily with the CoVAX vaccines, but we want them to be vaccinated with the Chinese vaccines, Sinopharm and Sinovac. People are concerned about the efficacy. I heard at the beginning of our conversation, they want the highest efficacy, and the question should actually be the highest available efficacy. Because no efficacy is worse than any efficacy. So, and all of them are 95% plus efficacious to prevent severe COVID. So I tell people, we are not here to prevent you from getting COVID. We're here to prevent you from getting COVID so badly you need to go to the hospital. If you get COVID and you have a cold for one day, that's not a problem. We just invented another cold. So and that's why the World Health Organization and the CDC in the US approved 50% efficacy or above, because the key is not the efficacy, it's the efficacy against severe COVID.
Kaso nga yung Chinese vaccine is just barely passing at 50%
that's
efficacy,
Sinovac,
right?
Sinovac. Sinovac is 79.
Yes, okay, so Sinovac. What if that's the one that
that's the one we're
gets here first? I mean,
kasi if it comes here first, then that becomes, in your words, the highest effective available.
That's highest, right. And the president should be vaccinated with that.
Yeah. But we have two samples that we know of. President Duterte, we already know the answer. He will get vaccinated, but not in public. On the other hand, we did a survey of one with Mayor Toby Chanco of Navotas. We asked him, will you take the Sinovac? And his answer was very candid. He said, well, not really. Pagka may nakita ko na rin, di ba? Again, let's go back to the original topic. If the president is out of the question of setting that example, and mayors themselves are, what's the communication strategy here?
Based on our work, there's so much vaccine hesitancy about the Chinese vaccines that if there is a perception that our politicians are avoiding those vaccines, it will be disastrous for the vaccine strategy of the Philippines. I will just be very honest. We will not be able to vaccinate our herd immunity without those Chinese vaccines.
Well, let me
be a priority.
Let me add in fairness, what Mayor Chanco also said was, and I want your response to this. He said, look, the worst case scenario in the case of people rejecting or not wanting to line up for Sinovac is they just wait. They just wait for the next. I mean, what's your response to that? And what are the real risks and losses there?
Okay, so the real risk and loss is if a significant number of Filipinos wait. One, those Sinovac vaccines will go to waste, which is a tragedy. Number two, we will have more deaths. We will have more lockdowns because we will have to wait months, if not years, for enough of the vaccines that are considered the better kind. So we're taking 2022, 2023. So do we want our children to be at home, locked up, without schooling for another year? You see what I mean? So we have to be very honest. We can say, look, you can get a Sinopharm this year. Next year, we have to get vaccinated again. So maybe then, the second time, you can go up in your efficacy. But for now, because this is a dire, grave emergency of global proportions, this is why I have talked to Mayor Joy Belmonte. She has reassured me that she is already publicly willing to be vaccinated with the Chinese vaccine. Our politicians are called to serve the common good. They are called to sacrifice. And this is a great opportunity for them to show that they are willing to sacrifice their individual good of maybe 20% efficacy to be protected against COVID-19, severe COVID, for the good of the country. And this is what I urge the president to do as well. The President Joe Biden was vaccinated twice on television. So was Vice President Pence when he was vice president. The reason why President Trump did not get vaccinated is because he got COVID. So yes, he can be the queen, but he is not a queen. He's a president, right? And so he needs to, and I'm respectfully asking him to please consider being vaccinated so his people, our people, can see that injection entering his arm so that they can realize if it is good enough and safe enough for the President of the Philippines, it will be good enough and safe for me and my family.
Father, let's plan out the communications. Let's plan out the communication strategy here. No, as we said, no. So we now need champions and examples, role models to be frontliners now in getting the vaccines. So political leaders, check. Let's hope that they step up. Now, failing that, we know we look to our doctors and our nurses, our frontliners. If a doctor will take it, that's but so on down the list. The clergy, who else do our people respect? Who else will they take the example from?
So it's actually interesting. So my UST-CoVAX team is made up of UST undergraduates. So we had this conversation. So they were really talking about influencers, right? So they're talking about actors and actresses and YouTube influencers. Now, the concern here, and this came up in my conversation with them, is that many of these influencers are young. So the danger we do not want to convey to the people is that if you are an influencer, you get to the front of the line. So one of the reasons why I encourage the bishops and the politicians and the doctors and nurses is because we can provide reasons why they are receiving vaccines, because they are at high risk for COVID-19. If you start looking for influencers, I've encouraged my students, if you could get 5 influencers from popular culture, who would they be? So maybe a few young people, especially young people, because we are going to find here in the US, we have vaccine hesitancy among the young, because the young think, well, they're not at risk. Why should I embrace the risk of the vaccine when the risk of me dying is practically zero? And so we need to have some young people with some young actor pairs. So I've been told that there are actor and actresses who are dating, maybe really or on TV, and these are the kind of people my students would like to be vaccinated in public. So we are going to reach out to them eventually as well.
Senior journalists are not on the list of the credible.
Well, actually, I would encourage you to be.
Chinese vaccine daw.
Not on the list of, parang,
Sige.
hindi ako influencer eh.
Ako.
About it.